good morning. This is Dr. Deuk. I'm here with my patient who some of you watched his video on YouTube yesterday. Now, you had a lumbar fusion,
Yes,
decompression, laminectomy. We had to do osteotomies, take some of the bone out to unrotate your spine because it was twisted and slipping. And then we also put spacers in and pedicle screws, rods. So we did a big reconstructive spine surgery at L34045. You went home the same day.
Went home same day, yes.
And now you're back today to have your drain taken out.
And
your
they took
wound
it out.
checked.
Did a great job.
So this is less than 24 hours after your surgery.
Exactly. And
Yeah.
I'm walking.
And you're walking and you're smiling.
Yep.
And you're not on a morphine pump getting
Nope.
stuff pumped in your veins. You're not in the hospital.
Nope.
So your type of surgery, 99% of spine surgeons would be doing it in the hospital, 99.999. But Deuk Spine Institute, we've been doing these multi-level lumbar decompression and fusions with reconstruction for about 6 years now. Every single one of them has been outpatient. And we do 2 levels, 3 levels, 4 levels, no problem. Everyone goes home usually about 2 to 3 hours after their surgery. Why is that? Because of the way we do the surgery is very different than anyone else. And you're sitting here today as a testament of that.
Yes.
Right? You didn't go to the hospital.
Nope.
You didn't stay as an inpatient. It was all done outpatient.
That's correct.
And are you happy?
I'm happy.
Yeah. If I took you to the hospital and did you the old-fashioned way, you'd still be laying in a hospital bed right now, doped up on morphine, getting in your vein, and you'd be in severe pain.
And probably be there for 5 days.
5 days if you're lucky. And some people have complications. They have to stay longer. But have you had any complications from your back surgery yesterday?
No. No complications.
You're
No. drinking? I'm drinking.
Have you started eating?
I ate yesterday. Let's see, yesterday I ate some supper last night, a little bit.
Great.
Yeah, and today I've eaten a little too, and I'm drinking water and had a soda. I mean,
Everything is working.
Yes, sir.
Almost back to normal. Now you do have a little bit of soreness in the back, right?
A little bit of soreness.
And nothing the pain medicine isn't managing.
That's correct.
Okay. Why did you have your back surgery? Why did you come to Deuk Spine to have a lumbar decompression infusion? Why did that happen?
It started off with a minor tweak in the back when I was walking my dog, and I was brought to see you. I was told by another surgeon, an ER surgeon up at Titusville, and they recommended you, and you guys pulled me in right away 2 days after I went there, and started out with a plan, and it's worked out great.
All right, good. I appreciate that. So, but what symptoms were you having?
Oh, I was having, I'm sorry.
That's
I was
okay.
having tingling down my leg. I was having numbness in my leg and in my buttocks on both sides. Both legs were tingling. I've had major pain in my lower back. It felt like a grapefruit size area of pain. And then over the last few weeks it got worse. And it's not there like it was.
So, is that pain you had before surgery there at all?
No.
It's gone.
No, yes, gone. I
So
just had muscle pain.
You had the muscle pain from the surgery,
Yes.
but besides that, which will go away in a few days, you don't have any of the pain you had in your back before.
No.
And you have pain down your legs?
No.
So we still have a little numbness, which is normal,
Yes.
right?
Yeah,
After
some numbness.
surgery. His nerves are being pinched severely, so we had to unpinch them. And numbness usually takes 3 months to 6 months to go away, but the pain is gone, and the weakness is probably improving as well. Now, big decision to have surgery. Were you afraid?
No.
No?
No, I was not afraid. That's why I've been waiting and waiting for you all to contact me because of just what's going on today. And once you contacted me, I was like, yippee.
Most people are afraid to have back surgery. What would you say to those people who are afraid?
I'd say come talk to Dr. Deuk and see what he can do for you.
Yeah, I appreciate you saying that. All right, so what are you going to be able to do now that your back's fixed? What are some of the things you want to do?
I have flooring in my house that I need to replace. I'll be able to ride my motorcycle again. Camping, we enjoyed camping, and with the way my back was, it just wasn't working to be able to go camping. So it's just allowed me to get back out and do normal things again that I couldn't do before.
Some people with back problems, or pinched nerves in their back, they end up, it affects their life, not just their hobbies and their other activities at home, but it affects their work. Did you ever have a problem with work, going to work, missing work? as a result?
Not in that case, because I do a lot of desk work, so that was actually the only way I could maintain going to work with that kind of pain was just at my desk,
Sitting at a
in
desk.
a chair. Because the minute I was up, the pain became worse. So.
All right, well, you're fortunate that you have a desk job. A lot of people don't, and
Exactly.
and that kind of problem would impair them from going to work.
And I totally agree with that, because if I would have been back 3 years ago, I was in the field doing auditing, I wouldn't have been able to climb the stairs and stuff that I needed to do.
You wouldn't have been able to do your job. Well, there you have it, folks. Less than 24 hours after a L3-4, L4-5, decompressive laminectomy, Smith-Peterson osteotomy, reconstruction, retwisting the spine back into alignment, and what's called the 360 fusion, which is inner body and posterior with pedicle screws, rods, and crosslinks. And sitting here less than 24 hours later, smiling. Congratulations.
Thank you, sir.
Go get well and enjoy life.
Yes, sir.
So we'll
I
see you
appreciate
later.
it.
All right.